Well, hello, it's Bruce Williams again, and today it's time for Growth Path Challenge number 43, which comes to us from the 2006 Growth Path Review course, which was given on the campus of the Uniformed Services University of Health Sciences here in beautiful Bethesda, Maryland. Always one of my favorite places to teach. It was a beautiful lecture hall, theater style, 175, 200 seats, and back in the day, in the early 90s and 2000s, when money was plentiful for lab animal and veterinary pathology students, they'd all come to Washington, and we usually have a full house for this course. Those were certainly the days. Photo acknowledgments, my colleagues who gave me images back in the day for these lectures, and always the archive of the AFIP. Here's one. There's one at the end of this test which I got straight out of the Associated Press. So, without further ado, let's begin. Get out your pencils, your pens, your crayons, your pieces of paper, and give yourself 60 to 90 seconds per question. Slide number 1 is tissue from a dog. Can you give me 2 morphologic diagnoses and 2 possible causes? Be back in a flash with the answer. Okay, time's up on this one. One of the morphologic diagnoses is fairly straightforward. This is a caudal aortic or saddle thromboembolus. Sometimes they are not attached. Occasionally they are attached. They grow over time. And then we have a fairly common secondary finding with thrombi in this area, and these are multiple renal cortical infarcts. Someone went ahead and peeled off the capsule, left it intact, and you can see there are hemorrhages within the capsule as well. 2 possible causes. Well, if you know the 4 major causes for thrombus formation, large thrombus formation in the dog, you could use any of those. Okay, excessive corticosteroid administration. Corticosteroids inhibit tissue plasminogen activators, put animals into a prothrombotic state. So that could be excessive by a veterinarian. It could be inherent in an animal with Cushing's disease. That would be one. Pancreatitis is a second, going back to a paper in about 1995 from Tom Van Winkle at UPenn University. The third would be severe kidney disease, renal amyloidosis, or glomerulonephritis, which results in a loss of antithrombin 3 into the urinary filtrate, and these animals are in a procoagulative state. And then finally, disseminated neoplasia. A lot of those will cause thrombosis. If you put down that the animal had cardiomyopathy, I'm going to give you that one. That's more of a cat thing. Don't see it as much with dogs with cardiomyopathy, but you can see that because they can get large thrombi in the left atrium, which will break off, shoot into the aorta through the left ventricle, end up down here, too big to pass, and then over time they will grow. So I'm going to give you a cardiomyopathy. That's a 5th possibility for a question like this. Okay, slide number 2, just an absolutely beautiful rendition. It is tissue from a cat. I'd like a morphologic diagnosis. I would like an etiologic diagnosis, and I would like the cause for this lesion. Give yourself 60 seconds. Okay, time is up. When you see the outside of a cat kidney, the first thing you want to do is look for white lumps, and you'll often see it, especially in certifying examination situations. And then you need to see if those little lumps are tracking the vessels on the outside, the vascular tree of the exterior part of the kidney in a cat. And if they are, then we're going to go with FIP. And if they're not, we're going to go with lymphoma. And these are obviously tracking those vessels here, here, and here. So the morphologic diagnosis that you want to put down is a multifocal coalescing lymphoplasmacytic renal vasculitis. That always comes first because it centers on the vessels. And then we're going to put nephritis to wrap it up. So multifocal coalescing lymphoplasmacytic renal vasculitis and nephritis. I don't mind if you put pyogranulomatous or you put lymphohistiocytic. They're all different. Every case, no case is the same, with the exception of the fact that they all start with the vessels and they move outward into the surrounding tissue. If it's a liver, it's an hepatic vasculitis. If it's in a lung, it's a pulmonary vasculitis. It's all vasculocentric. The etiologic diagnosis is 2 words only. Always 2 words. It's the organ and the agent. Etiologic diagnosis for this would be coronaviral nephritis. If you wanted to say renal coronaviruses, I'm perfectly happy with that. I think that one's a little awkward, but perfectly correct. And then finally, the cause is the mutated feline coronavirus. Okay, that's a virus every cat has, lives in the gut very happily. It's the feline enteric coronavirus. For some reason, in some individuals, it mutates and gains the ability to live within macrophages. Once it can do that, it takes over the place. So you could have 175 cats, 1 cat gets it. It's not a contagious disease. Happens within the individual. Okay, slide number 3 is a special slide for me, and I'll tell you why in a minute. This is tissue from a ferret. I want 3 morphologic diagnoses. Okay, time's up. If you know anything about ferrets, you know that a lot of times in middle age or in late middle age, they get these huge spleens, and that's what we're looking at. We're looking at one of these big spleens. Okay, I want 3 morphologic diagnoses. Number 1, either the 2 main causes of splenomegaly in ferrets. The number 1 cause by far is extramedullary hematopoiesis. Causes huge spleens. The spleens grow to 10 or 20 times their normal size. This is a stereotypical response in ferrets to chronic smoldering inflammation anywhere, but it's usually in the gut, and they produce all of these immature red blood cells, white blood cells, even megakaryocytes in the spleen as a result, but they never seem to get into the circulation, never help out the situation, but the animal just gets this huge spleen. The other one, and about 5%, is lymphoma. Perfectly acceptable. I take lymphoma on this one, splenic lymphoma. Great. Number 2, splenic capsular rupture. Oops. That's the problem with having big spleens. And then number 3, if you look right here, and probably the cause of the capsular rupture is a large infarct. Okay, spleen has a terrible blood supply. It's like a big bag of marshmallows, and the blood just sort of percolates around in there. And if you put way too many cells in there, the blood doesn't move very well. The spleen is an organ that's predisposed to infarction. All of its arteries are end arteries. The circulation's terrible. When you get too many cells for any reason, lymphoma and extramedullary hematopoiesis, sepsis, where you get too many macrophages, eventually it's going to infarct. Okay, reason this slide is special to me, this was my own ferret. I knew it had a big spleen. I was palpating it on a regular basis, and one day I guess it infarcted and I hit the wrong spot, and I palpated it, and that was an iatrogenic splenic rupture. The ferret didn't react, went off to take a nap, and woke up dead. So sorry about that one, and this turned out to be just gigantic extramedullary hematopoiesis. Probably should have gone and had the spleen removed, but you know, being a veterinarian, I thought I was being careful. Obviously, I wasn't careful enough. Okay, slide number 4 is an oldie but a goodie, and it is tissue from a pig. Can you give me a morphologic diagnosis? How about another one of those great etiologic diagnoses? And the cause. I will bet that this slide is older than any of us that are looking at it. Well, maybe not me, but I'm sure most of you that are looking at this on the YouTube channel. And it is a fantastic picture from the archives of the AFIP. And the morphologic diagnosis is diffuse mesenteric lymph node hemorrhage and necrosis. Remember, whenever we see hemorrhage, we're probably looking at necrosis, except in very, very rare occasions. So hemorrhage goes together with necrosis, like peas and carrots, like lymphocytes and plasma cells. And then, what are the 2 main causes of hemorrhagic lymph nodes? The classic is African swine fever. The cause will be porcine asfar virus. It's been sort of split out I think it used to be iridovirus way back in the day, and they sort of split it out and put it in its own category, and so it's an ASFAR virus, ASF, meaning African swine fever. You know, I firmly believe that the lesions of hog cholera or classical swine fever are almost identical to those in most cases, especially in field cases, of African swine fever. So if you put down that the causative agent was porcine pestivirus or classical swine fever virus, I'm giving you full credit. I think when you're faced with something like this, you just put the two together in your head. There's some lesions that are supposedly classic to African swine fever that you don't see in hog cholera, like splenic infarcts, but we just talked about how the spleen works. And I would imagine you could see that in hog cholera too. There's a lot of endothelial necrosis in these animals and thrombosis. And so classically, if you're a purist, this is African swine fever, but I'm taking hog cholera too. So the etiologic diagnosis would be nodal asfarvariasis or ASFAR viral lymphadenitis, or you could say pestiviral lymphadenitis. It's always nice to know how to make those etiologic diagnoses. They're sort of a shorthand in pathology. I hate to just give up on it because we seem to be moving toward a multiple choice world. So I'm going to continue to use some of these older forms of communication. I'm going to continue to give these short answer tests because I don't want to really let go. I think it's an important part of any pathologist education. Slide number 5 is tissue from an ox. Can you give me a morphologic diagnosis? Okay, time's up. This one is hopefully fairly much a slam dunk. We are looking at the globe here. This is the cornea. This is the lens. And then we have a large mass which looks to have arisen in the eyelid, the surface of the eyelid. You may have some here too. I'm not sure if it's gone all the way around and back into the back of the globe, but certainly you have a gigantic lesion. When we're talking about cattle, especially white-faced cattle, you have to consider squamous cell carcinoma. The morphologic diagnosis for this is an ocular squamous cell carcinoma. It's the number 1 most common ocular neoplasm of cattle. As we said before, white-faced animals are predisposed. There is a progression of these, and they start out sort of as plaques, and they may regress and they may not. They may go on to squamous cell carcinoma. I am not familiar but my mind always goes to it with any cases in which papillomavirus has been pulled out. But we see so much malignant progression nowadays of papillomavirus to squamous cell carcinoma. Interestingly, saw a case in a dog just yesterday of an animal who had previous papillomavirus lesion and then came back for re-excision with a squamous cell carcinoma. It's very common in the genitalia of horses as well. So always make the connection between papillomavirus and squamous cell carcinoma. I think these are just UV light damage, and then basically DNA damage to day after day to the cells of the eyelid around the eye, and eventually just says, okay, fine, and the malignant clone takes over. So ocular squamous cell carcinoma. Number 6 is tissue from a macaque. I would like a morphologic diagnosis. Okay, time's up. You've got to use all of the information you're given. This tissue from a macaque, it's an old world primate. Now, we have a very large or multiple masses within the caudal abdomen or the pelvic cavity. Here's the stomach here. It's sort of bloated. Maybe this animal didn't get to autopsy as fast as it should. But we're looking at this large mass which is sort of glommed everything together, and it's in the caudal abdomen or the pelvic cavity. When you see that, anything in the pelvic abdominal cavity in a macaque, first thing that should come to your mind is endometriosis. There is no external signalment that this is a female macaque, but anything that's bloody, anything in the caudal abdomen, in the macaque, you got to go straight to endometriosis, and you got to really be pushed off of that position. This is what's going on here. The morphologic diagnosis is, I would take serosal, I would take abdominal endometriosis. Okay, so this is a problem that we see in female macaques, older female macaques, and then they have a cycle that's very much like the human. So basically for a couple days out of every 28-day cycle, they're down on the bottom of the cage and they're in pain because this tissue, which has retrofluxed from the uterus into the abdominal cavity, has the same undergoes the same type of degeneration and necrosis, and then instead of being flushed out through the cervix, it actually just stays in there and causes a lot of fibrosis, and over time it just gloms everything together. I feel so bad for these animals because they're just absolutely miserable. So female macaques, anything in the caudal abdomen, want you to think about endometriosis. You cut these cysts open. They're known as chocolate cysts because it's breakdown products of blood, and they sort of a sort of brownish material comes out, which gives it the name chocolate cysts. Okay. Slide number 7 is tissue from a goat. Can you give me a morphologic diagnosis? Okay. Time's up. We're looking at the tip of the penis with the vermiform appendage, which is sort of an interesting a thing that goats have. But the problem with the vermiform appendage is that it often will get blocked if the animal has uroliths. The morphologic diagnosis I'm looking for is urolithiasis with urethral obstruction or obstruction of the vermiform appendage. And that's one of the problems with goats. And if you see a goat with a urolith, chances are most of the goats you have or a flock of sheep, a lot of them will have this problem. And this vermiform appendage obviously makes it very difficult because the urethra gets extremely narrow and easily blocked. The majority of the uroliths in goats, according to a recent paper in the Journal of Veterinary Internal Medicine by Jones et al., are struvite. And then the second most common are going to be calcium carbonate. So calcium carbonate and struvite are the two most common. Look for multiple animals if you see one. It usually has to do with the mineral composition of the ration, or what they're grazing on, or what they're getting into. And it's rarely just an individual thing. Okay, slide number 8 is one of my favorites. I often tell my residents, this is what you're going to look like right before you go take your certifying examination. Your head's going to be so full of knowledge. This is tissue from a chicken, as you can imagine. I'd like a morphologic diagnosis. I'd like a cause, and I would like 2 additional lesions. So morphologic diagnosis, cause, and 2 additional lesions in this animal. Okay, time is up. Morphologic diagnosis is bilateral granulomatous or caseous otitis media. Remember, there's really no otitis externa in birds. They don't really have an external ear, so this is otitis media. These are big caseous plugs. They're not suppurative. Birds don't make pus. The heterophils don't really have myeloperoxidase, so they don't liquefy their pus. Usually the best that you can do is that big heterophilic granuloma. It's a mass. It's sort of hard. You got heterophils in there, but they can't make it liquid pus. So a granulomatous otitis media. The cause of this, chronic granulomas, is what you can see with chronic pasteurellosis. So I want Pasteurella multocida. You get a lot of birds that die acutely. They have hemorrhage all over. You have infarcts of the skin and the wattles and a lot of hemorrhages inside. 2 additional lesions in the chronic phase that you may want to think about are granulomas of the wattles have a big caseous core. They're thick, they're hard, they're non-painful. You cut through, you see something very similar to this within the wattles, within the comb. Okay, you could see a chronic heterophilic and fibrinous pneumonia. You could see a granulomatous salpingitis, granulomatous air sacularis, granulomatous synovitis. So a lot of animals die acutely. Some will carry this, and this maintains the bacteria within the flock. Okay, we only have 2 more, so we got to do good on these so we can have a good weekend. But try and make it easy for you. Number 9 is tissue from a cat. Can you give me morphologic diagnosis and a cause? Okay, morphologic diagnosis is multifocal coalescing subpleural intercostal mineralization. This is a lesion that usually starts in the front of the animal, works its way backwards, and this is metastatic calcification, not dystrophic mineralization. It's metastatic calcification. The cause is renal failure. When you have decreased renal mass, you do not have the ability to excrete phosphorus. The kidneys excrete phosphorus. They just don't let it trickle out. They actively excrete it, but if you don't have enough kidneys, you can't get rid of it. So the phosphorus level is going to creep up, creep up, creep up. Due to Starling laws, your Starling's law, your calcium will creep down until eventually the renal, the kidneys are bad enough that no longer can they excrete any more calcium. So that starts to creep up too. When your calcium multiplied by your phosphorus levels exceeds 70, then you start to get metastatic mineralization. You start to see mineral in a number of stereotypical parts of the body, including this intercostal subpleural mineralization. You also see mineralization in the stomach, sort of in the middle of the mucosa. You'll see mineralization in the kidneys, mineralization in the lungs, maybe mineralization of the epicardium. When you get mineralization of the lungs, that's pretty bad because lungs become non-functional. This never really did anything to an animal, but it's a sign that other bad things are going on in the animal's body. And finally, slide number 10 from the Associated Press a number of years ago. Well, it must have been around 2004, 2005. The papers love to get a hold of these or put them on the internet. They're internet fodder. This is tissue from a kitten. Isn't it cute? Just laying there. I would say, kitten, close your eye and go to sleep. And somebody obviously had one of these kittens and then called the papers and got in all the papers. I would like a morphologic diagnosis. Okay, time's up. That didn't take so long. If you wrote down cyclops, I'm going to give you half credit. This really isn't a cyclops. Okay, that's what we call it, but this is not one eye. These are actually 2 fused eyes. The proper term for that is synophthalmos, and there's multiple craniofacial. So, judging from this, you obviously don't have to get into Veratrum californicum. That's sort of a ruminant thing. But this particular defect in the sonic hedgehog gene, or the homeobox genes, which cause a splitting, a bifurcation of the structures of the brain number 1, and then ultimately the bones of the face, which follows suit once the brain has split into 2 lobes. Doesn't require a plant toxin. It's seen in all species. It's seen in people. It's seen in dogs, cats, pigs, whatever. Okay, it's much less common. It's not induced by plants like it is in ruminants. But so other things that you are going to see here. This is 1 large orbit, 2 fused eyes. You'll see holoprosencephaly. Where instead of having 2 cerebral halves, you'll have 1 big cerebrum. The nose is gone. Where's my nose? There's probably no nose. If there was anywhere, it's up here, but it doesn't look like it's up there. So you will not have the elongation of the cranial part of the brain that forms the olfactory lobes. They're just not there because there is no nose. They don't form. The nose doesn't form. Okay, and then as we said before, one orbit, 2 fused eyes which never split. So the proper term is synophthalmos, not cyclopia. If you wrote down holoprosencephaly, I'll give you full credit for that too. Well, time's up for This particular Growth Path Challenge will be back tomorrow with one in the multiple choice format, which people really like, or at least the ACVP really likes. I'm not crazy about it. Gonna do one more. Hey, then I'm going to take almost a 2-week vacation. A 2-week vacation means that I'll be working. You're going to see a lot of new slides come up on the Facebook page and into Noah's Archive. I don't generally record these lectures when I'm on the road. So after tomorrow's lecture, I'm going to take a short break, but watch Noah's Archive, watch the Facebook page, because you're going to see a bunch of great slides and hopefully some decent comments from me over the next couple weeks. With that, I'm going to wish you all a happy weekend, good health, good weather, and a fantastic day. Take care now.